Hi, we're here with Dr. Michelle Bache, Vice President of Medical Affairs at Elkhart General Hospital. Dr. Bache, thanks for joining us today.
Hi, good morning, Heidi.
So we visited with you last week when we saw numbers dramatically increasing, COVID-19 numbers in Elkhart County. Tell us, what are we seeing this week? What's the current situation?
Yes, so more of the same. We are continuing to see a gradual uptick in the number of positive cases that we are getting in the county. If we look back at the past week, so Sunday through Saturday, the state is reporting 424 new cases through Saturday. The week before, Sunday through Saturday, they had reported 307 new cases. So things are still continuing on an upward trajectory, which is concerning.
And what are we seeing in terms of county by county? Where is Elkhart County in terms of the state?
So last week when we talked, Elkhart County had overtaken St. Joe County as far as our number of positive cases. That put us into fifth place. This week we have moved up to fourth place. We overtook Cass County for a number of cases of positives, and that occurred later last week. So we are close right now to Allen County. If our infection rate continues kind of on the pace it is, and their infection rate continues at the rate it is, I would expect that we could overtake Allen County by the end of this week. And so that would put us number 3 in the state.
Yeah, not something that we necessarily want to be seeing happening.
Not a prize we want.
Tell me a little bit about who this is affecting. Is it 50 and over, 50 and under? Who makes up a lot of these cases?
So a lot of the positive cases we're seeing are in the younger demographic. So we have seen, for instance, even the 0 to 19-year-old, they are responsible for an increasing number of the cases. We're also seeing the 20 to 29 and 30 to 39. Definitely the majority of the cases, I think it was like 69% of the cases are in the 50 and under crowd. So definitely those are the people that we know are out, they're going to work, they're maybe socializing more, and those are activities that we know are spreading the infection.
Yeah, interesting, because earlier on, wasn't it the older demographic was the more at risk, and that's probably still the case, and they're just not out?
Yeah, so I think that they are at risk, and maybe that's why they're not out. So I think that if you are 60 and older in particular, if you have comorbidities, it's very important to continue to self-isolate as much as possible. And I think that we are seeing, those people really, hear that message, and we're not seeing the infection spreading in that community as much.
That's fantastic. What is the situation at Elkhart General Hospital right now?
So the good news is that this increase in number of cases has not translated to a big spike in our number of hospitalizations. The number of COVID patients that we have in the hospital currently has been relatively steady over the past month or so. We definitely have lots of capacity, so we're thankful for that. And again, I think that's just looking at the type of people that are being affected here are younger, healthier, and maybe more able to overcome the infection without complications. So we definitely are honestly business like usual. So things are really going well as far as the hospital stands, but we have a close eye on the community and what's happening out there, so we're ready to respond if needed.
So yeah, so if you need care, if you're in need of emergency care, go to Elkhart General Hospital. There's no reason not to go to the hospital right now. What else are we doing, or what else can you add about what we're doing right now? Any efforts that you want to talk about, and any precautions that people still should be taking?
So the hospital's been working close with business and community leaders. I think the important thing right now is trying to get education out to the public and understanding that, as we do move around more, there is more risk associated with that, and trying to get a message out of ways to decrease that risk. I think the business community has been very proactive and done an excellent job of trying to keep their employees safe at work. The hospital, same situation. We really have not had infections of examples of widespread in our workplaces. But we're trying to educate the community about once they leave work, what can they do? Wearing masks, still socially distancing. If you want to gather, try to gather outdoors, making sure that you have good hand hygiene. If you're at-risk population, trying to, even isolate more. So we're just trying to educate the public. I think that's really important right now, so that they can, decrease the amount of spread we're seeing.
And we still have our mobile unit, that is the mobile clinic moving around Elkhart County, St. Joseph County this week.
Yep.
So
Yep, we're ramping up testing. We still want to be doing as much testing as possible. I would encourage anybody, if you have any symptoms that you think could be related to COVID, if you sore throat, headache, cough, shortness of breath, the loss of taste and smell, we're seeing that is a very specific symptom. If you have any of these symptoms, please call our hotline, and they can direct you to a testing site. We are partnering with different businesses in the community too, to try to bring testing even to some of our manufacturing facilities, so that their workers can be tested without any hassle. So definitely that's important.
So we are not out of the woods yet. Dr. Bache, we will talk to you again next week, and get another update, another status update on Elkhart County. Thank you very much.
I hope to bring good news next week.
I hope you have good news next week. Thank you so much.
Okay, thanks, Heidi.